Hello and welcome to this week's 5 on 5. I'm joined today by David Cauble, the new CEO of Sky Lakes Medical Center in Klamath Falls. David, thank you so much for joining us today.
Good morning. Happy to be here.
Absolutely. Now, you're less than 2 weeks into your new job, but you do have 25 years in the healthcare industry. What excited you the most about coming west to Oregon and taking this position?
Well, I think it starts with the community here in Klamath Falls and just the opportunity to really come into this community and work with this medical staff and the folks here and make an impact in the health and well-being of this community. So it starts there for me, and rural healthcare is a passion of mine. And so the opportunity and again, just to come to this beautiful area, it's quite remarkable coming from the Midwest out here to the Pacific Northwest has been quite the wonderful experience for me and my family as well.
Absolutely, I completely agree. Now, the pandemic has certainly changed and impacted healthcare. As someone who's been in it for so long, what has been the most dramatic difference that you've seen in the last 2 years?
Yeah, it's a great question. I think, and one of the things that we've all talked about, not just within healthcare, but the impact that it's had on morale and isolation and some of the challenges that's certainly the challenges that it's presented to the healthcare community as they're both in the setting of a hospital dealing with sick patients and just the stress that produces. And then even when you go home, so there's really no relief from what we've experienced. And so coming back together as a community, one of the things here that we've talked about already is just as we come out of this pandemic and really working together to re-engage across the community and across within the hospital itself, the staff, the medical staff and others. And as we get excited now about what's next and what we've learned through the pandemic, but also how we can come together and build on that experience, but do it in a positive way.
Absolutely. Now, in your experience, I know you mentioned morale. How do you go about keeping your frontline staff happy, healthy, and working when so many are utterly exhausted, especially after 2 years?
Yeah, it's a great question, and I wish I had an easy answer. I think it's one that we're all struggling with. But I think as we spend time, I think it starts with listening to what's going. That's what I'm spending time doing now as I'm brand new to the organization, is really just taking time to listen and hear what's going on and understand the stress that's taking place here at Sky Lakes and across Klamath Falls in the area, and understanding that, and then trying to respond in appropriate ways and doing things as we can, as we're allowed to get staff back together so that they can engage with one another and see each other in ways perhaps that we haven't been able to do for the pandemic and other reasons.
All right, David. Well, thank you so much for your insight. We'll be right back after this break with some more topics and questions.
Great. Thank you.
Welcome back to our 5 on 5. We're here today with David Cauble, the new CEO of Sky Lakes Medical Center in Klamath Falls. Now, what advice would you give our viewers about COVID-19, the pandemic, potential risks of new variants in the future? From your experience, what would you want to say to them?
Wow, that's a big question. We're trying to address it here, certainly with the guidance and the advice of our medical staff, and we've got a great medical staff here that's lived through the thick of it, and we're trying to be as open and transparent as we can with what's going on in the community, and whether it's respect to vaccines. Certainly that's been a big part of our emphasis here in Klamath Falls, trying to encourage people to take advantage of those things, and we'll do our best to continue to try to keep the community informed of things and ways to improve their health, and as we move maybe out of the pandemic stage into what we hope will be some level of new normal for us. But the communication from us, I think, will be important going forward as well, as it has been in the past.
Now, we've talked about the pandemic a lot, but outside of COVID-19, what is your biggest challenge in taking on this new role?
I think rural healthcare has been stressed for many years before the pandemic, and the pandemic certainly exacerbated that to some degree. We look at the health disparities, and it was more evident because of the pandemic. And so as I look to the future, it's really about how we transform and continue to impact the health and well-being of communities, and in particular, the region that we're called to serve. So I think that for us is the opportunity is leveraging technology, perhaps other things, working with the community. We serve a wonderful population, but in many parts of the region, they don't have good access. So we want to try to address some of those things. And so those are the challenges that we face here, and that many organizations and smaller communities face as well. So it's an exciting time to be here. I think Sky Lakes is incredibly well positioned, has a great legacy that I get to the opportunity to build on. But I think that's where we have great opportunity in the community.
And as you mentioned, Sky Lakes has a huge role in healthcare in the Klamath Basin. Has anything surprised you, or what has surprised you the most about the organization?
Yeah, it's a great question. As I've come in, I had certain expectations, and I would say in my short time here, I just continue to be impressed with the staff, the warm welcome that I've received, and not only just by the folks here at the hospital, but across the community as I've started to meet people. It's a wonderful community, so I won't say that's a surprise. It's actually confirms what I thought and hoped I would find. And so I really, truly am excited to be here. It's the medical staff and others that I've met already. Just a dedicated group, excellent clinical care, and so no surprise there. I fully expected that, but it's nice to have that confirmation.
And speaking of the Sky Lakes team, longtime CEO Paul Stewart is staying on in an advisory role to aid in your transition. How important is it for you to have someone with that kind of local experience and contacts kind of by your side during the transition?
Yeah, I say Paul's a wonderful partner already. He and I've, in fact, I just spent some time with him this week, and he is obviously, after spending 30 plus years here in Klamath Falls, he's staying here. He's completely dedicated to the community. He's done such a great job creating the foundation that is Sky Lakes, that I'm privileged to pick up the mantle and carry it on now. So he is a wonderful resource. Just even as I have conversations and say, well, help me understand what's the context behind this issue, or what was the history here. There's so much knowledge there. And just as somebody who's been a long-term CEO, just to come along as a friend and give me some guidance is invaluable. So he's a wonderful resource. And I've just, in the short time I've gotten to know him, I really appreciate his willingness to continue leaning in and helping me be successful, and helping to make sure that Sky Lakes continues to grow and be successful as well.
Absolutely. Well, thank you so much for your time today, David.
Thank you. Appreciate it. Wonderful to talk to you.
We'll be right back after this.